As we reported earlier, former President George W. Bush has successfully undergone a heart procedure after doctors discovered a blockage in an artery. He had a stent procedure. Let's focus in now. Joining us is Dr. Hurley Alkotob, a cardiologist with Hurley Medical Center. Doctor, thanks so much for joining us. First up, explain to us what a stent procedure is.
Well, Terry, a stent procedure is something that's being done on a daily basis almost in the United States of America. The simplest way of saying it, it's a tube, a metal mesh, that we insert within a blockage, and we open it up so it can dilate the blockage to allow the blood to pass through the artery and supply enough nutrition to the heart muscle.
All right. And how long is the recovery for something like this?
The immediate recovery in the hospital usually doesn't take longer than a day. So the patient stays overnight and go home the next day. We do ask the patient to watch out for the next week because of the groin incision or the arm incision that we perform in order to insert the catheter.
Why would someone get a blocked artery?
Well, there are many reasons, as you could know already, that coronary artery disease is one of the most common diseases in the world and the leading cause of death. Genetics is definitely one of the major factors that we cannot change, but also our lifestyle, the industrial lifestyle that we have, the lack of activity, the increased cholesterol, and a lot of environmental factors all play a role into this.
All right, former President Bush, I think one thing everyone can agree on, he always seemed to be working out and was physically fit. I know he's 67 years old, but some people may be surprised at that.
Well, I would say that the former president is a terrible example in that regard because people may get the wrong message. He certainly worked out a lot. He was very, very active, and that definitely has helped him. And this is the message that I want to get out to people, that if you work out more and those other risk factors that you cannot change still influence your heart, the fact that he did so much exercise probably delayed the progression of disease and made his presentation so much more controlled as opposed to one that could be a lot more dangerous.
Interesting. Now, he just went in for a regular exam, I believe, and they found this, so he didn't have any symptoms. Are there any symptoms that people can say, oh, I'm feeling this, maybe I got a blocked artery?
Obviously, the prime example is chest pain. When patients feel tightness in their chest or their inability to perform their usual activities with a lot of shortness of breath, that would be the classic example of symptoms. However, particularly in ladies and women, there are subtle symptoms that don't exactly seem the same. People may feel numbness in the arms. They may feel that they're just unable to perform the same physical activities that you used to do.
All right, the former president has encouraged everyone to get checkups. I imagine you would be encouraging that as well?
I think that's an incredible message that he has to put out, and I would add to that message that, and the fact that he has been so fit has helped him a lot throughout this procedure and throughout the process of this disease. But most importantly, if we leave ourselves and we leave those risk factors unchecked, one may get a sudden presentation of the disease, which may not be as forgiving.
All right. Hurley Medical Center, I imagine, can you ballpark how many procedures like this you do?
Well, we've been very fortunate at Hurley Medical Center. For several years now, we've had state-of-the-art facilities where we perform the procedure on a daily basis. The stent procedure we do at this point, we perform it even in more difficult presentations when people present suddenly with acute heart attacks, and we've had a lot of good luck with the outcomes that we've done.
All right, Dr. Hurley Alkotob, thanks so much for coming in. I appreciate it.
Thank you so much, Terry.
Good
Appreciate
information.
it. Thank you.